Thank you. Thank you, sir. At the outset, we do not have any financial disclosures. I'm going to present the same thing. So last year when presented this paper, we were in the peak of COVID-19 and we were almost recovering from the second wave. So COVID-19 did teach us that, we need to look into the power of rapid diagnosis, the power of immunology, and how to modulate it to have a better patient outcome. The earlier we diagnose it, the better it would be for patients. We do have some knowledge gaps in refractive surgery, like patients having extremely high post-LASIK discomfort, inflammation or dry disease, neuropathic pain, which is the pain without stain, absolutely normal preoperative evaluation. When we do a refractive surgery, post-surgery, they land up into post-LASIK ectasia, progression in keratoconus, and haze or scarring post-PRK or cross-linking. So we have done a thorough clinical signs and symptoms checkup. We have done a thorough medical history, systemic and dry evaluation, imaging parameters. But still post-refractive surgery, we do come across some complications. What is the missing link here? Why do we need it? We do understand that the molecular markers are involved, and these are the inflammatory cells which are responsible for the poor wound healing, haze, dry eye disease, ectasia, and ocular inflammation, which this thing might impact the surgical outcomes, response to therapy, and choice of medication, which might be for refractive surgery, keratoconus, cross-linking, dry disease, and many other ocular surgeries which we perform. There are a lot of trials going on potential specific molecular biomarkers in ocular diseases and the potential therapeutics. But the question here is that how do we identify these molecular markers? How do we identify that what is wrong in the patient and what drug the patient will need? So we wanted to know, can we have a point of care diagnostic kit to diagnose these ocular changes? The answer would be, first of all, we need to choose the right markers. So the markers which are commonly involved in the increased discomfort will be IL-17, VEGF-A, MMP9, ICAM-1, KC progression or post-LASIK ectasia, markers involved in post-PRK haze or cross-linking haze, pre-refractive surgery evaluation for ectasia and dry eye, pain without stain, and retinal conditions. So there were some markers which are common across all these conditions. We chose all of them and we decided to build the point of care diagnostic kit, which is a ELISA-based fluorescence microfluidic device based on the antigen-antibody reaction, where the antibodies are present in this well and the antigens come from the tear of the patient. And this is how the markers are incorporated in the kit. We recruited controls, post-refractive surgery, dry patients, keratoconus, and patients with various other conditions, and subjected them to tear collection with Schirmer's strip and the test. We collected Schirmer's tears using the Schirmer's strip in an Eppendorf tube, and to this Eppendorf tube, 300 microliters of extraction buffer solution was added, and then it was shaken for 5 minutes so that all the inflammatory molecules will go in the tears, and then these tears were put in the cartridge and put in the analyzing system, which is the diagnostic device. At the end of it, we get values for each of these markers, and based on the reference interval, we can decide whether it's normal or abnormal. What we saw was that patients with chronic contact lens use, dry eye, progressive keratoconus, or non-responders to dry eye management had significantly higher levels of IL-6 and IL-8, which is suggestive of inflammation and which requires customized treatment. And this test was also done for glaucoma and retina-related conditions. What we found was that not all the patients had higher levels of VEGF-A, and giving anti-VEGF for these patients was not an appropriate treatment, and they required steroids in this case. Applying it to clinics, it has beyond refractive surgery, it has applications in cataract as well. Patients with chronic itching, discomfort, poor wound healing, glare, halos, poor optical quality, or refractive surprises are because of the subclinical inflammation present in them. And if we know that any of these markers are on the higher side, we can customize the treatment with either using trehalose-based drops, doxycycline, steroids, or modern-day dry eye therapy for each of these markers and have an optimal outcome. The way forward would be that we are working on the retinal conditions like vascular occlusions, diabetic retinopathy, ROP, dopamine levels in tears, and glaucoma conditions as well. And we are also collaborated now with a pharmaceutical company who will help us produce these kits, which will be available after this FDA and the CE mark approval. And this has a role in cancer detection as well. Actually, if the VEGF levels in the TR are higher to begin with, even if the patient is not a known case of a cancer, any type of cancer, you can detect it in the TRs before patient knows about it. So point of care diagnostic kit does help us in identify these biomarkers. TR biomarkers can help us in diagnosing subclinical inflammation, and this is the first panel in the world in eye care with multiple markers to diagnose various ocular conditions. And right now we are working on the regulatory approvals as mentioned. Thank you.
Excellent talk, Dr. Pooja. This MMP9 kit is available, I think.
MMP9 is available, so that's a standalone kit,
Okay.
and that will only tell you if the MMP9 levels are higher or lower. That will not give you a quantification. Anything more than 50,000 is higher, but if the patient has a level of 2 lakh, then only a cyclosporine will not work. So there you need a modern day dry therapy. So that's how this kit will help. And along with MMP9, we have other markers also.
How much the cost is roughly?
This will be produced in India, and the company which we have collaborated it is like Atmanirbhar, so we might have a cost of 1400 for both the eyes. At this point of time, the Inflama dry eye kit which is available is 1400 per eye. This will be both the eyes and with multi-markers.
That will be affordable.
Yes, and I think a lot of Indian companies are now working on lifitegrast, so that also will be available soon.
Thank you. Thank you so much.